Hello everyone, you're welcome to this video, and on this video I'll be talking about the HCA pathway. There's been a lot of conversation about it, but this video is meant for professionals who are confused and they don't know what to do. They are thinking, should I go for it, should I not go for it, what do I do? I believe that this video will help you to make an informed decision, as I'll just be bringing my own perspective to it. And my name is Catherine, and thanks for watching my video and try to even view my channel. Please like, subscribe, and click on the notification button to get regular updates from me. Thank you. So without wasting your time, I would like to get into the details of the video. Okay, so the first thing I would like to talk about is that the HCA pathway has been quite controversial among professionals. I've seen videos that will say, oh, nurses don't do this, oh, nurses do it, oh, doctors, why would you want to come for HCAs? No, don't come for HCAs. And I also like to skip the basics, please pardon me. I want to talk about your requirements. There are a lot of videos that has given detailed explanation of what you need, what you don't need, and all of that. But for professionals who are confused, I would like you to listen and please follow me. So the first thing I would like to talk about, like factors that you might need to consider, and this might help you to know, should I do it, should I not do it? The first thing is your age. If you're young and you're like 20s, 30s, you're single, you're young, you're single, you have no family, and maybe you struggled with high health for a while and you're not just getting what you need, the required band score, then I would say that yes, you can go for the HCA route. And also, if you are more like 45, 50, and you don't have kids that are dependent on you, like maybe your children are already independent, they are out of the university, and also you've tried the high health number of times and you're not just getting the required score, then I would say that you can go for it. But if you are like your 30s and you have families, like especially if you have kids and you have 0 to 2 years, like very young kids, 3 years old, 4 years old, 5 years old, it can be quite demanding for a family, and you're bringing your kids over on a HCA salary. And this is because if you have a family, you will be subjected to some certain things based on UK regulations, like housing. For example, you can't put your kids in just 1 room or 2 rooms. You have to get a 2-bedroom flat or 3-bedroom flat, depending on the number of kids that you have. If they are both sexes, if they are not both, genders, if the genders are different. UK has they have their rules as regards that. So this might really put you under a lot of financial strain. And that's why I'm saying that it might not be so comfortable bringing children over. And also you consider the number of kids too. If it's just 1 kid, then that's fine, because childcare is really expensive here. But if you have like 2, 3, 4 kids, and even though your wife or your spouse might be working, might be supporting you, but believe you me, if you do not have that good job that will give you enough money, it will be really, really stressful. So that's number 1. That's age. And that age depends on the fact that whether you're single or you are married. Then the other thing is about the finances. I've seen a lot of videos that said, oh, HCAs or senior carers earn about £2,000 and 1,800. I've seen 2,200 also. And yes, I'm not surprised. I've heard things like this because most of these HCA jobs are from care homes, private hospitals, because you cannot get an NHS job and you're earning like 2,200. It's not possible. NHS do not pay as much as other care homes or private hospitals. With this sponsorship, I believe that a lot of NHS might be offering sponsorship also, like a lot of NHS trust might be giving out sponsorship. But if you happen to be on that NHS, then you cannot be getting like 2,200, except you want to work, like you really work so hard, like no off, you take a lot of extra shifts to meet up. And if you're saying you want to work in these care homes, it varies. Maybe if you pick some bank shifts, that's when you work on public holidays, or when you work on some night shift and all of that. Yes, you might get to have more money, but you find out that it's also equivalent to the cost of living here. And that's why I try to put into consideration that if you have a family, then you might find out that you might think you're earning so much, but you're spending so much also on bills. Because in these days when you have a family and you're getting a accommodation or a flat or a house of about 700, 600, 650, depending on the location. There are some locations in UK that are really, really cheap, and there's some locations that are like on the high side, quite expensive to get an accommodation there. And you find out that you're paying like your house rent is like 750 or 700, and bills are not included. What I mean by bills are not included is like your electricity, your water, your Wi-Fi, and all those petty bills and all of that. So by the time you take away all of this money, then you find out that you just have little money to spend. So the finances, you have to consider that. And that's why I would still say that if you are single and you don't have a family, then it is fine. And of course, you also need to, if you are married, or like you have a family, you and your spouse needs to decide, what do you do, what are you going to do when we get to the UK. It's not like you come and start figuring, oh, what do I do, this is what I want to do, or this is not what I want to do. Also considering the family side. I've talked about age, I've talked about finances, I've talked about family obligations, like your family size. The fourth thing I want to talk about is disengaging from this contract. I've seen videos where people say, oh, it's just 2 years contract, you can actually sign this contract, and when you get there you can just tell them, I'm not interested anymore. You get a better offer, especially for professionals that have started their immigration process already. Like you've written your IELTS, you've written your CBT. I'm talking as regards nurses now. You've written your IELTS, you've written your CBT, and all you're waiting for is job hunting. Like you're looking for a job, but it's not coming forth, and people are saying, oh, why not pick up the HCA route? And when you come here, you try and get an offer, and you can disengage from this contract. I would like to say that it might not be so easy to say you want to just disengage from the contract. The first thing is because the money being paid for HCAs, especially if you are working with NHS. I work with NHS, and that's why I'm coming from that angle. It's really, really small. It's not really a big money. Like your basic pay can be like 1,300 or 1,500 pounds. But of course, if you're single and you can pick enough extra shifts, you might be able to get like 1,800 and all of that. So now you want to you still kindly consider that you always have to pay your bills, your house rent, you eat, and of course you want to do fine boy, fine girl, and all of that, buy clothes and all those stuffs. And now you need to pay them a sum of money. Like you pay them, like, okay, if I don't want to work with you guys anymore. I've heard stories where people pay like £6,000, £8,000. In some trusts, it's quite like it's a bit on the low side, and this is considering the fact that maybe the number of years the individual has worked with them, because most contracts are like 3 years, 2 years. But if you get a 12-month contract, that is good. So you can just determine, okay, I'm working for 12 months. So disengaging might not be so easy. That's just what I'm trying to say. But of course, if you have the funds and you're ready to pay it, then why not? You can disengage. But coming to the UK, I'm like, let me just come here and I will disengage this contract. It might not really work for you. It might not be so easy. So I just want you to also consider that. So the fifth thing I will talk about is ambitions. For professionals, definitely, we all have our ambitions. HCA job, it's not really, how do I want to put it? I want to be careful, because everybody is important. They play key roles when it comes to care, when it comes to patient care, patient safety, clinical interventions, and all of that. HCAs, senior carers play they play key roles. But as professionals, like you're coming as a nurse or you're a doctor and you're coming to the UK and you're working as a senior carer, it takes a lot of things from us. Like you are a professional before, and you come in here and you're helping people with their washes, changing their pads, cleaning them up when they mess themselves up, and all of that. So it takes a lot. That's what I'm just trying to say. So now if you are planning to say, when I come here, maybe because of IELTS, for example, you've tried IELTS a couple of times and it's not just working out, and you feel, let me take the HCA route, and when I get here, I write my IELTS examination and I continue with my my professional processing and all of that. It might not just work out that way, because that you are in the UK doesn't give you the guarantee that yes, you're going to pass the IELTS. It doesn't give guarantees. I've seen people that they came here and they still had to write it 2-3 years, or people that even came here on masters and they were struggling with their IELTS. So you just need to prepare your mind, because I know Nigerians are very ambitious people. We have plans, we have our goals, we have the things we want to meet, like goals that we set for ourselves. But coming here, you might find out that it's not so easy to do all of these things. So there might be some downfalls, there might be some ups and downs. You just need to be prepared if you still want to go for it. But if you feel like, okay, I can stay and try and do all my processing and finish it and come as a professional, then that's also good. I'm just trying to say that it is not really so easy when you're a professional and you're taking something that looks like a lower offer to what you are. You know, it takes a lot of you. You have to be humble. You have to take your head, go away, and be able to do the job, because right here there is clear job boundaries. You can't say, oh, I'm a doctor or I'm a nurse, I know these things, and you just go and do it. They are so clear on what their rule says, and they don't want anybody going stepping out of their boundaries. So that's another thing. Okay, now the last thing I would like to talk about is the mental pressure. It's not so easy when you're coming to a place and you have so much you have to do and you're just doing something for a while. I'm trying to put myself in that position, because every nurse, when you come in here, you come in as a pre-registered nurse because you are here to write your OSCE. Except for people who wrote their OSCE, who passed, then they can get their job straight up as a nurse. But for me and many other nurses out there who came from Nigeria, we had to work as a registered nurse role, and that's a senior carer role. That's like a band 4 role, and it was not so easy. Believe me, I'm going to be so honest with you. It was not so easy when you come into work and you're doing the nursing assistant's jobs, like you're waiting for your husky, you have so much in your head, like you just like, I have to pass this examination, because you know if you do not pass this examination, the longer you work as that role, and it's really not easy. I'm not saying that the role is, it's I'm not trying to say like it's difficult, but it is really demanding. It's demanding, especially for a professional, when you're like, this is not what the things I'm supposed to be doing. I'm supposed to be doing something much more than this, like an higher just like higher role for you, but you are right there. What you're doing is wheeling patients, cleaning up patients, giving them commodes, washing them, assisting them with feeding and eating and all of that. You still do that on your normal activities as a nurse, but you know it's different now. But this is your core role, so that mental pressure is there. And some people, believe me, some people might not be able to stand the mental pressure, especially if things do not work out the way they plan it. And coming in here and you see your other colleagues, like you're a nurse, and you see your colleagues that are nurses like you as nurses, and you're working as a HNA. So it's really, really not easy. So you need to think about that mental pressure. You need to think about your ambitions. You need to think about your age. You need to think about the family obligations. Put all of these things together. Think about your person. Do you think you can do this? How determined are you? If you make peace with it, that okay, whatever it is, I'm going for this, then it's fine. But if you feel like, okay, I can still wait and just make sure I get the job, I pass my IELTS, I ace those interviews, then that's it. I don't want to bore you too much, but I believe that with this few points that I've mentioned, it will help you in 1 or 2 ways to make a better decision on whether you should go for the HCA pathways or not. So thank you very much. Please subscribe to my channel. You can drop your comments, you can ask your questions, and don't forget to also click on the like button. Thank you and bye.